Hey there, it's Dr. Noseworthy. Today we're going to be talking about blood sugar and adrenal patterns. And this is part one, or an introduction to the main concepts. And what we'll do is that we're going to split off with some additional videos that are more specific to different types of blood sugar and adrenal patterns or dysfunctions that we find. So for example, after you're finished this video, I'll want you to watch whatever video related to the specific blood sugar pattern that you have. And I'll tell you why this is important. First of all, blood sugar control, which is really about fuel supply or energy for all of your cells to do the things that they're designed to do. Blood sugar supply is what we call a deal breaker. And what that means is that if you have a blood sugar pattern, which we'll identify in your initial report of findings when we go over your initial labs, if you have that blood sugar pattern, but we don't help you learn how to control that through proper diet, supplementation if needed, then that becomes a significant obstacle or limitation on how far you can actually get better, right? So being a deal breaker basically means that there's a physiological process that's so important to everything else that if it's not working, then there's not much else that's going to work either, right? So this is why we put these things up front in our video series, as well as making sure that we focus on these typically in phase one of all of the programs that we put together for people. So if we've identified, for example, that you have a reactive hypoglycemic pattern or an insulin resistance pattern, right? Either on the low or the high side of blood sugar control. I want to make sure that you take the next step after this introduction and watch the videos that are specific to that, because there are different recommendations depending on what type of blood sugar pattern that you have, or even the adrenal patterns that we identify if we're doing saliva and we've gotten that far. So let's just start with the core four. These are the four main concepts that we're going to be going through today. We're going to talk about some simple blood sugar patterns, the more common ones that we find, and give you some lab values so you can start checking these things yourself. We're also going to talk about the impacts of blood sugar control on different aspects of human function and physiology. So for example, on energy production, sleep patterns, adrenal output, and there's even connections here with brain. We're going to talk about that adrenal connection in a little bit more detail, but remember, this is just the introduction. And then we'll end off by talking about some strategies that we can start to employ. So let's start with the most fundamental. Like, how does blood sugar work? Well, what you're seeing on the screen there, up on the top, that orange tube is basically representing your bloodstream. And then down here we have a circle, somewhat of a circle, that represents your cells. Now, ultimately what happens is that when you consume food, your blood sugar levels go up. And most of this is going to be coming from carbohydrates, but it is possible to create glucose out of amino acids, which we get from protein. So your body has this amazing ability to kind of invoke backup plans. So for example, if I'm not eating food on a consistent basis, I can break down my muscles to create amino acids from which I can manufacture glucose to provide energy for my cells. And this is what we see in starvation states. And this is what we see, not nearly as severe, but we see it in people who just don't eat on a frequent basis. For example, it would be hard for them to exercise, to put on muscle mass, because you're constantly breaking muscles down. But nevertheless, when glucose levels go up, what ends up happening is that the pancreas senses the rise in blood sugar and secretes a hormone called insulin. And what insulin does is it comes over and literally opens a door on the outside of your cells. And all your cells pretty much behave the same way, that when your blood sugar goes up, in order to get the glucose into your cell where you need it to burn it for fuel, that's really a function of insulin. So as long as you can make insulin, as long as your pancreas can sense that your blood sugar has gone up, as long as you can make insulin appropriately, and as long as the cell responds by opening that insulin-based gate, then you have the opportunity for glucose to go from the bloodstream into your cell. Now, as a result of what we just saw here, I want to make sure that you pick up on one thing, is that you don't clear all of your glucose out of your blood vessels, right? If you had zero glucose, you literally would be dead, because you wouldn't have the fuel to run your systems. And in fact, as we start getting into descriptions of what happens when low blood sugar occurs, a lot of these things are triggering fight or flight responses, because your body, and in particular your brain, which is the most glucose sensitive system that you have, there's a connection. Let me say it this way: there's a connection between your brain's survival and fuel capacity, meaning if you cut off fuel to the brain, then the brain starts to die. And so the brain is very sensitive to glucose fluctuation. So as blood sugar goes down, it quite often triggers things like fight or flight responses. So back to the slide, we have food going up, glucose levels go up, your pancreas makes insulin, it opens up the insulin gates on the outside of your cells, we clear out a portion of the glucose that's available at that moment, and then we can successfully burn those glucose molecules for food. So inside your cells are little organisms called mitochondria. And I say organisms because, really on a structural basis, they're somewhat related to bacteria. But what a mitochondria does for you is it takes your glucose, it can actually take some fatty acid molecules as well, and it uses that as fuel for your fire. So imagine that you're sitting in front of a fireplace and your fire is dying down, is starting to get cold and dark. Well, you take more wood and you put it on the fire, and then the fire burns hotter, you get more heat and you get more light. And that's really what glucose is when it's inside your cells. It's fuel for your mitochondria to create the energy that your cells and your systems need to run all of the functions of the human body. Right now, this is kind of the fundamentals. And then there are some nuances and there are some other energy-based systems that we're not going to get to at this point because we're predominantly focused in the beginning of a program in making sure that the primary aspects of fuel consistency are working in your favor rather than working against you. Now remember, this is a deal breaker. If we have a blood sugar pattern and we don't pick up on it, or if we don't teach you how to control that and improve it in the long run, then at some point all of our efforts are going to fail. So I want to make sure I give due emphasis to how critically important it is for you to make sure that you're controlling your blood sugar. And we're here to teach you and to coach you through all of that with these videos, with the articles, and of course in our one-on-one sessions. Well, here's the big picture. If we look at the spectrum of blood sugar patterns, all the way on the left-hand side, which would represent the low end of blood sugar, we have low blood sugar states, what we call reactive hypoglycemia. And I'll describe it quickly. We'll come back to it in just a little bit. When blood sugar comes down, the brain, being glucose and energy sensitive, says, hey, I don't like this. I'm going to trigger a backup response, which is actually tapping into your adrenals, which, depending on how much they access the adrenals, can literally trigger a fight or flight response, right? So low blood sugar states are perceived by the brain as a threat to survival, and quite often people with low blood sugar reactions, they get shaky, they get irritable, they get lightheaded. It's almost like they have an adrenaline rush, right? And that's actually pretty accurate. On the right-hand side, we'll skip the middle there for a second. On the right-hand side, we have high blood sugar states, which is really kind of a continuum. All the way at the most extreme end, we have the different forms of diabetes, right? Type 1, type 2, etc. But all of these, the high blood sugar states, have one thing in common. And that's this thing called insulin resistance. And again, more detail to come in this video as well as others that are specific to the high blood sugar states. But insulin resistance is basically where the insulin gates on the cell don't open up, right? Everything else happens the way it's supposed to, but it's almost like the gate has a rusty hinge and you just can't get it open enough to allow the glucose to go in. And so, for example, insulin resistance is the mechanism by which someone obtains what's called a metabolic syndrome. This is commonly called prediabetes. So you might even call insulin resistance pre-diabetes, because you go typically from insulin resistance, and as they get worse, you get into metabolic syndrome, and then if that continues to get worse, you can acquire type 2 diabetes, and some of those people actually convert into a type 1, which is an autoimmune type. So we have our classic low blood sugar states, we have our classic continuum of high blood sugar states, and it actually is possible to have what we call a mixed pattern, which is where you have elements of both. And we may see that just with symptom expression, right? Some people may have some symptoms of low blood sugar plus some symptoms of high, and other people may have lab findings that are consistent with both. And you might think, well, that doesn't make any sense because, isn't it like a gate that swings open and closed? It's either open or it's closed. Well, it can kind of be halfway in between, right? It's half open or it's half closed, depending on how you look at it. And so it is possible to have elements of both. And it's easy for us to pick that up by looking at your symptoms and by looking at your labs. And if that's true, we'll coach you appropriately. But this is the big picture, right? This serves as the foundation and the core principles that we need to talk about. So let's talk very quickly now about reactive hypoglycemia. Now remember, if this is what we've already identified with you, there will be another video that goes into more details, right? This is just the big picture in the spectrum. One of the key things with reactive hypoglycemia, which we'll define as coming from persistent or intermittent low blood sugar, is that we tend to have missed or small meals. Somebody's just not eating enough or eating consistently enough to fuel their system. And so what ends up happening is we have a decrease in the amount of glucose in the bloodstream, which means if we only clear part of that, what we end up with a state where inside our cells, where our mitochondria want to burn glucose for fuel, is that we just don't have enough glucose to run the show, right? It doesn't mean that you stop everything, but it's a matter of efficiency. And it's a question as to whether or not a fuel state is going to settle the brain down and keep it under control, or if the brain is going to sense a low fuel state and then start triggering this fight or flight response. And that starts to verge on the connection between the blood sugar states and adrenals, and we'll talk about that in just a little bit. But the key thing to remember here is that, remember, whenever we have glucose available, we never pull it all out of the bloodstream, because then we would crash, we'd go into a coma. And if that continued, we'd die, because everything is fuel-based. But if you're missing meals consistently, or maybe you might eat consistently, but you're just not eating enough throughout the day or at any one given time, it decreases the supply of fuel that's available for your cells to create the function things that are kind of underlying whatever that system is. So, for example, if it's a heart muscle, if it's a skeletal muscle, if it's a neuron in your brain, if it's your pancreas or your liver, all of these cells require steady, consistent, stable fuel, so that at any moment, if that cell needs to pull some glucose to get energy to do its job, it has to be there and it has to be available, right? So this is our reactive hypoglycemic with persistent or intermittent low blood sugar states. Now, on the other end of the spectrum, it's not really an issue of supply, but with insulin resistance. And remember, this, as it gets worse, we call it metabolic syndrome or prediabetes. And if that gets worse, we'll actually see diabetes itself. But the problem here with insulin resistance is not a lack of fuel supply. And in fact, usually what ends up happening, I don't have this animated or showing here because I don't want to clutter the screen up too much, but typically people with insulin resistance patterns, high blood sugar patterns, tend to accumulate more glucose in their bloodstream than is normal, right? So we talk about somebody having high blood sugar. That's what we're talking about. But with insulin resistance, the problem is where the insulin gates actually don't open. So we have high glucose, high blood sugar. The pancreas still makes insulin, and then sometimes it makes too much. But the high glucose and the high insulin levels, as the pancreas continues to make more to try to get these gates to open, actually shuts down the mechanism that allows the gates to open. So instead of, say, 3 gates opening, you might get 1 gate open. Now, this is just an illustration, right? So it's not specific. It's not exactly how it works, but I'm trying to create a mental image for you. And so what ends up happening with insulin resistance is that you only clear a small fraction of what's available. And so, yes, you end up having less glucose in the cell, which means you may end up in the same condition as having a low blood sugar condition, right? Because you don't have enough fuel to pull into the cell. Or you can prevent the gates from opening and you still end up with low intracellular or inside the cell energy production. You end up in the same place, but the mechanism is a little bit different. But one of the problems here is that as you clear out, over time, as you clear out only a small portion of what's available in circulation, your blood sugar levels continue to rise. And this is an issue because glucose is actually a toxic molecule. This is why people with full-blown diabetes end up losing their kidneys. They end up losing sensation because their nerve endings are dying off. They lose the retina, their cornea breaks down, so they lose their vision. Bottom line is this, is that people with full-blown uncontrolled diabetes, they don't really die from the diabetes itself, but they die from all the tissue damage that happens, and they suffer greatly along the way And the system that really ends up degenerating the most is the brain and the heart, right? So people who have diabetes end up having strokes, they end up having heart disease or having heart attacks. And that's really ultimately what kills them. But the mechanism is the constant high circulating glucose, because glucose damages tissues, which is why the insulin response and being able to control blood sugar is so critically important. It's about making sure you have enough glucose and not running low, but also making sure that you don't run too high. And it's kind of like what I call the Goldilocks principle. Or it's not too low, it's not too high, it's just perfect. It's just right in the middle. And again, a lot of diet and lifestyle strategies employed here, and in cases when it's appropriate, nutritional supplementation as well. So the insulin resistance issue is a problem where the gates don't open, right? So insulin comes in and tries to open the gate, but it doesn't happen. As a result, less glucose in the cell, less energy production, glucose backs up in the bloodstream, and that causes tissue damage. And the reason why it does is because it is inflammatory. It's a toxic thing. So when people have insulin resistance, or they're on the high blood sugar spectrum, we talk about these conditions being universally systemic inflammatory conditions. So if you show me someone with an insulin resistance pattern, I will show you someone who's inflamed. And that inflammation may express in different ways. It may be fatigue, it may be pain, it may be brain fog. Inflammation will hit people in different ways. But we know for sure that, number one, low blood sugar states are bad for the brain, and they tend to drive fight or flight responses. High blood sugar states are toxic to your tissues, they're inflammatory, and they also potentially involve these low energy states as well. All right, so that's kind of the spectrum that we're dealing with. So here's a couple of things just to kind of guide you along the way, and I'm going to go into a little bit more in terms of the classic symptoms as well as the timing, because it's important for you to be able to recognize, do I have a high blood sugar? Did I just have a high blood sugar event, or am I having a low blood sugar event? And again, a lot of times one-on-one, we clarify this stuff for you as we look at your labs and your symptoms. But on the low blood sugar side, technically we do call this reactive hypoglycemia. Sometimes we'll call it functional hypoglycemia, right? This is when the blood sugar is low. The classic symptoms are when somebody misses a meal or they wait too long to eat, they get shaky, they get irritable, they get lightheaded, they get tired, they get some kind of a symptom that improves or resolves as soon as they eat food. And we'll see this over and over again, that somebody says, I feel a lot better when I eat. Well, if you feel better when you eat, it means that you were losing function prior to that, and that's an energy-based problem, right? So again, if you skip meals or wait too long to eat and you get shaky, irritable, lightheaded, tired, you get a headache, you get any kind of symptom. These days we call it getting hangry, even a mood change, right? Getting irritable and that kind of stuff. That classically points to a low blood sugar event. But what's really happening is that your brain is going, hey, I don't have any fuel. I need to tap into the adrenals to create a fight or flight response to get this person to go feed me, right? That's really, in essence, what's happening. Now, the classic timing of low blood sugar problems is in between meals if you're waiting too long to eat, or they're when you miss a meal. Like, hey, I was supposed to eat lunch, but I didn't, and now I'm getting these symptoms. Or I wake up in the morning and I'm not hungry, so I didn't eat breakfast, but by 10 o'clock I'm falling apart. That's your classic reactive hypoglycemia problem. Standard labs will typically see a fasting blood sugar at or below 85, and we'll see another marker called LDH at or below 140. Now, there's a lot of subtleties here, a lot of nuances. We do have people who have very finely tuned systems that actually operate pretty well when their values are around here. So I need you to kind of go with us as we interpret the lab data for you. It's not as simple as just looking at the numbers. We have to look at the context, what's your current diet, what's your symptom presentation. But that's your classic low blood sugar. Now, on the high blood sugar side, the insulin resistance, remember this is a continuum. Typically, high blood sugar symptoms actually come after meals and not before them or between them. So after meals, particularly if there's too many calories or too many carbohydrates, then the classic symptoms are post-meal fatigue and cravings for, say, sweets or stimulants. Like the person who eats and always needs chocolate or candy or something sweet. someone who eats and always have to have coffee, or someone who eats and they want to go take a nap like it's, hey, I just ate too much at Thanksgiving, I need to go lay down for a while. That's a classic high blood sugar response. There are a few other things like food sensitivities or histamine responses that can create this as well, but the vast majority of these situations where you get tired or have cravings after you eat, these are blood sugar related, where your blood sugar is backing up and you can't get it into your cells to burn it for fuel. Now, some standard lab findings, and I don't want to bore you with details and numbers, but blood sugar tends to be high. This is fasting blood sugar. There's another marker called hemoglobin A1C that goes up. And again, we'll take a look in your labs to see if this is true or not. But as insulin resistance gets worse, then it starts to change your cholesterol or your lipid panel. Typically, cholesterol and triglycerides go up, and in some cases, it may affect an inflammatory chemical called uric acid, and it may affect your liver health. We may be able to pick up. Now, it doesn't mean that everyone with insulin resistance will have this pattern exactly like I show you here, but there's some degree of different elements of that, right? So it is a spectrum. It is a kind of a continuum. So that's your classic low blood sugar, classic high blood sugar, and then we have a mixed pattern, which there's really no technical name. We just call it a mixed dysglycemia or a mixed abnormal blood sugar condition. And that's where people have both. For example, if they wait too long to eat or skip a meal, they get shaky, irritable, lightheaded, but then they eat and then they get tired or have cravings for sweets or stimulants. Sometimes the symptoms are more dominant if they skip a meal. Sometimes they're more dominant after they eat. And even when we look at their labs, they may show some contradictory findings because the numbers suggest on one hand a low blood sugar state, and in some other cases it may suggest a high one. And these are a little bit more tricky to pick out from a lab standpoint. But typically, if anybody shows up and they have symptoms of both, we're going to find certain things, right? And that's my responsibility to figure those things out and then coach you and teach you what you need to do to change and to control that. So let's move into the second core concept, which is the impact of blood sugar control. I'm just going to make a few quick comments about each of these so we don't spend too much time on the introduction. But basically, when you have low fuel, you've got low energy. So you can have low fuel because you're not eating consistently, or you can have low fuel because you're eating, but you can't open the insulin gate. Either way, whether you have a low supply because you're not eating consistently, or you have low accessibility to the cell because of a rusty gate that you can't open up, either way, the cells don't have the fuel that they need to thrive and to do their function well, right? So low fuel can mean to low energy. A lot of times these conditions fire your stress responses, and it's an additional stressor on your adrenals. There's a direct relationship between the two that I'll outline in just a moment. But blood sugar impacts almost always come associated with some kind of an adrenal dysfunction. Next, we see a huge connection here with sleep patterns. And the sleep patterns are one of three different presentations. We do have another series of an article and video on sleep, but it's either a problem with falling asleep, staying asleep, or waking up not feeling refreshed. If somebody can sleep all night long and just wake up and say, I'm just so tired and beat up, I can go back to sleep again. And I would venture to say that about 80% of sleep issues are rooted in blood sugar and adrenal dysfunction. So that's typically what we work on first. These blood sugar patterns drive inflammation either on the low side because they're firing adrenal fight or flight responses, which necessarily involves inflammation and activation of the immune system, or we're causing inflammation because high blood sugar states are by their very nature inflammatory, right? Glucose is a toxic molecule. There's a lot of hormonal imbalances come along with adrenal dysfunction. And usually what ends up happening is for both men and women, significant blood sugar problems tend to flip your hormonal balance. So men start producing too many female type hormones. Women start producing too many male type hormones. And even though we call them male and female hormones, we all have them. So I have estrogen and progesterone. And if you're a lady that we're working with, you have testosterone, you have androstenedione. It's just about the balance and how that picture works. And so blood sugar problems tend to change that. So with women, we see a lot of premenstrual type issues. We may see brain-based issues. We may see PMS, we may see menopausal type issues. A lot of times we'll see detox and acne issues associated with a woman's cycle. For guys, it can cause what we call andropause, right? So hormonal balance is really affected by blood sugar control. One of the other things, and this is one of the key things that we often have to work on, is that blood sugar imbalances tend to increase fat formation. And the inflammation and hormonal shifts that happen with blood sugar problems shuts down your fat burning capacity. So not everyone with a blood sugar issue will gain weight, but a large portion do. And again, if part of our goal is to change your body composition, and whether or not we have a stated goal of, hey, I want to lose 10 pounds or 50 pounds, sometimes we have to work on the fundamentals. So we don't put people into, for example, a high intensity exercise program right away, particularly if there's a blood sugar and a fuel problem. Number one, you can't fuel the activity, which means you typically can't recover either. But if the problem is a metabolic switch where the blood sugar has triggered increased fat deposition and has shut down your fat burning capacity, then we've got to work on the metabolic problem that's actually causing that, right? So we work on blood sugar first in many cases. And I've mentioned already how blood sugar is connected with the brain, so it's almost given that if there is a blood sugar issue, there's going to be an impact on brain chemistry that may or may not be significant enough to deal with directly, but granted, over time, continued blood sugar problems, I'm talking about years, not necessarily days, weeks, or months, but a lot of times people who live for decades with these problems because no one's been able to help them, they start to show early neurodegeneration. What that means is an increased risk for things like dementia, Alzheimer's, Parkinson's disease, and that kind of thing. Now, there are many other things that we could put in here, but these are probably the things that we see most often in clinical practice. And there's certainly things that are very well demonstrated in the medical research, right? So we kind of have to think about all of those with all of our clients. Now, third concept in the core four is the adrenal connection. So cortisol's main role, cortisol is your primary stress hormone. It's not the only one, but it's the one that most of us look at and talk about. And we can measure this most appropriately with saliva testing, although you can do some blood. It's a little bit limited, but saliva is certainly the best way to do it. But cortisol, its main role is to control blood sugar. Like, we think of cortisol being a stress hormone as your fight or flight hormone. And it is true, but most of us are not living our days as if we're being chased by an angry bear in the woods, right? That would be a true fight or flight response. Or we're not in the middle of a mugging all the time. So a normal day, you're getting up. Cortisol's responsibility is to wake up your brain, to increase arousal, and also to get your energy systems going, right? So cortisol's main role is to wake up the brain and help you to start control your blood sugar. And so as a result of that relationship, there's a general rule that if your cortisol levels are too high, then typically you're going to see low blood sugar, and you may also see low arousal or awareness states in the brain. And it doesn't mean you're catatonic. It just means that your brain's not working as well as it should. On the flip side, if you have high cortisol, then that tends to promote high blood sugar, and it doesn't mean you're going to be hyper aware, right? It doesn't necessarily work that way, but high cortisol is typically associated with high blood sugar. However, as black and white as that sounds, there are a million shades of gray in between, because it's very common for us to see people who have low cortisol but high blood sugar. And that typically is a result of not just the high blood sugar, the inflammation, the chronic stress depleting your adrenal system, but there are other factors that affect the adrenals, not just your blood sugar. And the same thing is true. We can see people who have high cortisol and low blood sugar. So there's the black and white, and then there's the reality of how your body works. Because one of the rules that I learned early on in my career of trying to help people with these complex illnesses is that, you as my client, your body reserves the right to do whatever it wants to do. It doesn't have to follow what's printed in a textbook or what's written in a journal article on medical science, right? There are the rules, but then there are always exceptions to the rule. So we never know what combination any one person has without looking at the labs. Symptoms can help guide us, but sometimes symptoms and numbers don't match up, and we have to figure out what the issue is, why they don't necessarily agree with each other. But again, it's very common to have low cortisol and high blood sugar, which is not what you would really expect. So if that's kind of a contradiction, we have to figure out why. It is what it is. We just have to figure out the reason. So we have our black and white relationships, and then we have all the steps in between. Now, this adrenal connection is based on the fact that cortisol has what's called a circadian rhythm. And what that means is that cortisol levels actually vary depending on the time of day. So we said earlier that cortisol, its main job outside of a true threat to survival, its main job is to get you up in the morning and to get you going. And so we'd want to have higher cortisol levels in the morning than the night, because we actually want at night to shut everything down, right? We don't need a lot of energy when we're not up and moving around. And we want to make sure that everything puts us in a position where we can fall asleep, where we can rest, where we can recuperate and regenerate, right? And that's incompatible with having high cortisol. So the circadian rhythm goes like this: that cortisol should be high in the morning and it should be low at night, right? That's a circadian rhythm, and it's part of your biological clock mechanism, and it's tied to sunlight, right? So if you're living in an area where you don't get a lot of sunlight, or if you find that some of your symptoms that we can track back to, say, blood sugar and adrenals are coming, they're worse in the wintertime, but, the winter you don't see a lot of sun, there's a direct connection there, right? Your internal clock and your biology is tied to a normal wake-sleep cycle, and that's tied to when it's light and when it's dark. And we'll talk more about that in a different lesson. Well, very interesting, cortisol is the opposite of melatonin. You may notice or recognize melatonin as being one of your major sleep hormones. And there's all kinds of different things that are involved in sleep. So just taking melatonin isn't guaranteed that it's going to help whatever sleep pattern you probably or might have. But think of it this way: cortisol wants to wake you up and get you going, and melatonin wants you to shut down and relax. So melatonin has a circadian rhythm as well, which is completely opposite of cortisol. While cortisol is high in the morning, melatonin is low. And then as you get towards the nighttime and light starts going down, cortisol levels go down and melatonin levels rise, which is part of how we trigger the sleep mechanism, right? So these are some of the complexities that we have to look at. And here's a nice little graph looking at this relationship. So you can see, we're going through a timeline, 6 in the morning to midday to 6 at night to 12 in the morning, and then back to 6 o'clock in the morning the next morning. And so cortisol is the red line here. So it's high in the morning and it comes down and it's low at night. And then melatonin is low and then it rises and then it starts to go down as well. Right? So this is important for me to know the nuances. Probably the only thing that you need to remember is that there is a connection. You don't have to worry about all of the different details. And one of the things that I'll come back to in another video is that the concept of adrenal fatigue is as I say here, it's not quite a myth. The issue with the concept of adrenal fatigue is it just kind of says that the adrenal gland is tired. And that's not really true. I mean, that's people who have short-term adrenal issues. The problem could be the gland itself, but most of our clients have chronic problems. And these chronic problems are mediated by things outside of the adrenal gland itself. And so the perspective that we use as we look at everything through the lens of your brain, your hormones, and your immune system, we look at adrenal function predominantly being brain-based with heavy influence driven by the immune system as well as neurotransmitters and all the things that affect that. And there's a lot more detail in some of the articles that we have. And we'll come back to this idea, but I tend not to use the terminology like adrenal fatigue, adrenal exhaustion, even though it's very commonly used. It's just a holdover from 30, 40 years ago when these issues started coming up to doctors' attention, but they didn't really truly understand the nature of how the brain, hormones, and immune system work together to control things. And so when we look at chronic adrenal dysfunction, we think, okay, what's going on with your brain? What's going on with your neurotransmitters or brain chemistry? And what's going on with your immune system? Because those are the things that tend to drive chronic adrenal dysfunction. So what about primary strategies? Well, again, this is just the introduction, right? I feel like I'm giving you a ton of information already, but I guess that's okay. Primary strategies when we're dealing with these blood sugar issues tend to fall into two categories. One is the rhythm and timing of meals. So whether you've got low blood sugar states or high or some kind of mixed pattern, we need to make sure that we coach you and you follow our instructions about the rhythm and timing of meals. Some of our clients have to eat more frequently. Some have to eat less frequently. And then we have to deal with questions like, is intermittent fasting a good idea? Should we do a short-term fast like 2 to 3 days or 5 days? What about ketogenic diets, right? All of these have to be customized to you as the individual based on your physiology, based on your symptoms, and then of course based on what we see in your labs. And then we have to look at diet content, right? Sometimes people with low blood sugar states, they're just eating the wrong stuff. They're not only eating too frequently and too little, they're just eating the wrong stuff. And so we have to have a content piece there. Same thing goes with the high blood sugar states. And usually it's eating too many calories and eating too many carbohydrates. Secondary strategies then are going to be supplementation. I would never try to fix somebody's blood sugar problem just by throwing supplements at them without teaching them how to eat properly. That doesn't make sense to me, right? So we have to start with the diet piece first, and then ask the question, do we need to add supplementation in the short term while you're learning to control and stabilize this? And part of the reason for using supplements is because, number one, it makes the learning process a lot faster. We tend to get symptom control a lot faster. But in the long run, ideally, we want blood sugar patterns to be controlled through diet and lifestyle choices, not through always having to use supplementation, right? Some people do need long-term supplementation, and that would be people who have chronic low blood sugar states that have damaged their energy systems, and we just need the support all the time. And it also applies to people who have diabetes, particularly the type 1 variety, which is an autoimmune, and there's a permanent nature to that. Not necessarily type 2, but certainly type 1. So that's our core 4. In summary here, blood sugar is absolutely fundamental. We talked about this being a deal breaker. It's really important to know what your pattern is and to obey the rules for frequency, timing, and content of your meals. Poor blood sugar control is going to wreck your health on many levels, right? So we need to make sure we prioritize that up front. And as we go through your program, we're going to shift and transition our clinical focus, but you can never forget to control your blood sugar. That's something that becomes a lifestyle, right? That should be something that you're doing long term. We also talked about how blood sugar and adrenals are intimately connected. More information coming in different videos on that. And then just a clinical tidbit and a takeaway is that most chronic adrenal issues are really brain-based, also involving brain chemistry and what's going on with your immune system and your inflammatory load. Okay, so that's it for our introduction. Make sure that you're following whatever guides and rules that we've given you already. If we haven't gotten there, sometimes our clients watch these videos up front before we have a chance to go through labs, and that's okay. That shows a high level of commitment. So if you don't know what your pattern is yet, just hold on. We'll be identifying that when we go through your labs. So take care and make sure you tune in for the next lesson, and we'll talk to you soon.